children in rural Alabama and children in low-income parts of Alabama often don't see their medical doctor, don't see their pediatrician very often.
We have a huge need for health identification for health problems, early screening. We don't have a hospital in this area.
We have disparities in healthcare access. In some of our more urban communities, we have easy access to doctors, to preventive health care, but in some of our more rural counties and cities, we have no access.
A lot of these children might not have the opportunity for health care. They may not have the insurance. Being in a rural area, their parents may not have a job.
People think because a child can run and play and eat, they're healthy, and not realizing that there may be some underlying problems there.
Our goal is to provide a first line of defense to detect health problems that may otherwise go undetected, either because kids don't have access to care. This may be the only health screening that they receive in a given year.
This program has provided an avenue for us to deliver that service and to provide a healthier lifestyle for our students, which in turn makes them a better student in our schools.
The KidCheck Plus program partners with nursing schools across the state. Student nurses with the faculty do most of the screenings, but we also have healthcare professionals, dentists, and other types of healthcare professionals that come in to help with those screenings. We partner with the school system and the school nurse that's there, and even the community is involved in helping pull the whole event together.
Over 20 nursing programs across the state of Alabama have partnered with KidCheck Plus because it's a win-win situation for all. The children in the counties win, the nursing students win, the community wins, and the academic institution wins.
It really is a team effort, and KidCheck has made our job as school nurses much easier. They get all the equipment set up. They have the tables set up when I come in early in the morning. They beat me to the gyms, and they get the tables set up and all the computers out. This is where the students come in and bring their parental consent forms. They enter their information into the computer, then they begin to do their assessment.
They'll start with getting like their height and their weight. When we do their blood pressure, we'll know whether their blood pressure is normal or whether they may be pre-hypertensive or they may already be hypertensive.
And they enter all the data into the computer on this particular child.
The technology has revolutionized the program. It's digitized it, it's taken the paper out of the process, it's speeded up the time for follow-up care.
Over 20% of kids have dental issues, over 20% have vision issues. We've also found children with high blood pressure. We found kids that were on the verge of going into a diabetic coma and they did not realize they had diabetes. So we've had children rushed from KidCheck Plus to the emergency room. And so KidCheck Plus is not only improving lives, it's saving lives.
We hear stories all the time of children that were in a KidCheck Plus health screening and maybe had diabetes or had some other serious medical issue that was found and then treated.
When I was 15, I was diagnosed with mitral valve prolapse dysautonomia, which means my autonomic nervous system is messed up, so anything that's supposed to do whatever its purpose is by itself doesn't quite do it right.
You know, we had taken her to the doctor. She had access to medical care, but it just wasn't caught. Where with KidCheck, they have lots of great equipment, and it was very thorough, and they were able to pick up on it.
This is something that could have gone on for a long time without being noticed, could have been detrimental to her health.
I'm just really grateful for the KidCheck Plus program. It's really a blessing to have, because there's a lot of other children that can't exactly go to the doctor, and this can give them a chance to be screened and be checked up and have those normal checkups that everybody needs to have.
KidCheck Plus is truly making a major difference in children's lives in Alabama.
I have never seen a program quite like KidCheck anywhere else in the country. The level of robustness and the number of kids that they're interacting with around the state of Alabama, both in rural areas and urban areas, really is unmatched to anything Verizon has been exposed to.
We're just so thankful to an organization such as KidCheck.
It's giving our children an opportunity to be successful.
We need to see more of it in other schools.
It is such a success for our students. It is such a success for the children, and I want to be a part of it.
A healthy student is a better learner.
When we can begin our children to become health conscious at an early age, then that's something they can carry them throughout their lifetime.